Just a few announcements of things that I've been watching in the chat. I know a lot of people have left already. But all of these talks, the discussion, everything is recorded. It'll all be uploaded onto YouTube and be available probably sometime next week. Just depends how long it takes me to edit everything. Um, we will also try to figure out transcripts. I know there's been requests for summaries on each video, so we'll have to discuss how to make that happen as I am not a scientist. But we're definitely considering all of the suggestions. We have also saved the Q&A, and we're discussing the best ways we can to share that. I know a lot of people want those questions saved, and we're also talking about ways that we can answer some of the most prominent questions and maybe produce some videos a little bit in the future to answer some of those main questions that were being asked. So just keep your eyes open for that. We are trying to figure it all out. This is our first webinar, so thank you guys for your patience, us troubleshooting. We hope that you guys all enjoyed it. I also have some sources that I put in the chat, but I'm just going to say them aloud as well. Michelle is looking for PET scan volunteers. She said you can email, it's mcooper, Cooper, 4 @stanford.edu. And she says they need healthy controls as well as patients. So if you have family members that are healthy, she would love for the whole family to be a volunteer. For people that are local to Stanford and want to volunteer, you can email Anna. That's Okumu, Okumu @stanford.edu. OMF Study ME. That's omf.ngo/study ME. This is a global registry. I know there was some confusion about this. No personal medical information is required to join this registry. It's only your contact information and the areas of your research interest, and then they pair you with researchers based on their guidelines. So it's just a way to connect you to researchers directly in order to be a donor. Sorry, the next one, Vicki Whitmore mentioned that NIH brain donation. That's braindonorproject.org. It works with brain banks in the US supported by NIH, and it's part of the big neuro brain bank network at NIH. And again, all of these places always need healthy controls as well as patients. So if you can get your whole family to join, that's even better. And I wanted to say a quick thank you. Vanessa, over the last 4 days, has been moderating this whole meeting for us, and she has done an awesome job. It's a lot of work. Rob has also been running all of the discussions. I know he's getting hoarse and hates doing it, so we really, really appreciate all of his work for this, as well as Jennifer, who helped me set up this whole webinar, which can be complicated through Stanford. So I really appreciate all of the help for organizing this whole meeting. And now Ron with some closing remarks. Thank you, everyone.
Yeah, thank you, Ashley, very much. I really appreciate I really appreciate all the help that you have provided and setting up this meeting. Um,
You can just talk. It's not going to show your face.
Well, in setting up this meeting and inviting people, I've always found it a great advantage to find people that are very smart, but are not arrogant. And that's been to some extent the success of this meeting, because those individuals are more likely to collaborate. And you've seen that here, and all these people are of that nature. And you can saw all their interactions and help one another in their own research. So that's been a big benefit. And I remember when Linda Tenenbaum and I got together a long time ago to set up OMF, um, I said I could find a number of scientists that would help. And I used the same criteria of these very smart, unarrogant people. And that's been a key there as well. And you've seen a number of them speaking today. The other thing I'd like to comment on is that in my experience, because I've interacted a lot with all these scientists, um, they are very concerned about the patients. And they really want to help alleviate the suffering, and they really want to figure out a cure. And that's important to know because these scientists are all able to do much more fashionable science. MECFS is kind of the backwaters to some extent, as I think patients actually realize. And it's not recognized very much by NIH in terms of the funding level. A lot of other scientists kind of feel it's maybe just an artifact. So it's hard to work in this field as a scientist, but what's driving them to stay into it and work full time, and I think that goes for every one of them, is that they understand the patients are suffering and they know this is a very complicated disease, but they were willing to stick with it and try to do their best to figure it out. And it also is why they are very willing to cooperate and collaborate. If I can help you, I will do it, a kind of attitude. And you saw that also today. So I think patients should be very cognizant of the fact that people are working very, very hard to figure this disease out. And I think we've seen, I think in scientific terms, we've seen lots of progress from this year, from last year. And I know it's slow, but the whole process of doing this is slow. And not just because of the MECFS, but in research in general. You know, how long have we worked on trying to find a cure for cancer? We're making small progress and are getting there, but it's not a completely trivial thing to solve. Also, initially, a lot of the research was simply making measurements of things and showing you these block plots of how the patients compare to healthy people. And that was extremely valuable and useful in the beginning, essential really. But as time goes on, it's less essential. We still need to do it because we don't understand the disease, especially if you have something new that has never been measured before. You can find surprises. We certainly have found a number of surprises that we had any thought that it would be true. Um, but we also now, I think, need to start moving towards generating hypotheses, and you've seen that here today. A lot of hypotheses, and Rob is really good at putting that together. But Bob Navio as well has a hypothesis and a potential treatment. So when you have a hypothesis, you then have to try to test it, and you have to set up systems to test that. And you've seen that here today as well, with like the zebrafish model, and as well as other models that have been worked on that were discussed in the working group. And these models can then test hypotheses, and that's how we can get to actually understanding this disease better. The measurements just tell us what's going on. The hypothesis tell them a little bit about maybe the mechanism. If we know the mechanism, we have a much better chance of intervening and actually curing the disease. And one of the things that Rob and I struggle with a lot is, why does this disease last so long? Why don't you just get over it? And there's something there that's happening that would be helpful to understand. And we need some theories about that as well. Anyway, I hope these talks were useful to you. I think you should be aware that there's a lot of activity going on amongst a fairly small number of labs, actually, compared to other fields. But we are making progress. And also, a lot of young people are going into this field, even though they can see that it's a really tough field to go into, not because it's, well, not just because the problem is hard, but the support for it is not really there. And also the patients, as Ashley just said, can be a very big integrated part of this problem. Um, because we actually don't understand the disease completely. And the other thing is that we need like diagnostic tools, and we can't do diagnostic tools without having patient samples. So I welcome your participation in helping us do this. One of the problems we faced is when the pandemic happened, it was not really considered safe for patients to come into the lab. And so I understand that, but we're getting past that a bit. And also how we do that in the lab is, I think, fairly safe in the sense that uh, we have a single room that people come to for donating blood and then they can leave. Um, and we want it in the lab so that we can process the sample immediately. If it's done in a more clinical setting, sometimes it's hard to process it quickly. So the sample goes from blood collection to the processing lab within about 5 minutes. And so that actually helps the quality of the research that we do. Anyway, this is a revisit to an experiment we did years ago when we did it in person. There were hundreds of people on this site, and that's much better to do by Zoom. Um, but if it seems useful, we'll do it again. I also want to thank all the people that helped put this together. Uh, I mentioned Bob Robert Fair, and he was key in helping do a lot of what we should do, and Ashley helped tremendously in doing all the organizing of the meeting and all the hard stuff of getting the speakers to respond. um, but also Vanessa was great at helping keep everything together. And a person in the background, I think you saw a picture of her, she was on, and that's Jennifer Vidal. And she's the one who organized with Stanford putting on this Zoom meeting that was sponsored by Stanford. And I thank Stanford for it as well. And then I really want to thank all the speakers for, for participating in this. The patients should actually also know that nobody gets paid for any of this stuff. Uh, they're just doing their job, and there's no big reward uh, for doing this. But the reward is helping the patients. So if you're feeling they're helping you, it's good to to acknowledge that, and we're doing our best. Well, with that, I think I'd like to really uh, conclude this meeting and hope it was very useful. So thank you very much.